address homelessness. And I'm going to ask our Vice Chair, Commissioner Cunningham, if you'll lead us in the pledge.
Please stand. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you for that. So welcome, everybody. I just want to, for those of you who are driving into the Civic Center on your way to the meeting, you may not have seen our federal building that has been, in my opinion, occupied by National Guards, something that we don't need. And as somebody who grew up on these streets in Santa Ana, I'm very, very unsettled by the presence of such, militarized equipment. I think it's unnecessary, it's unwarranted. There is a lot of grief and harm going on in my community. This is my district. It's a very unrecognizable place for me. A place where we've seen families, we've seen people going to work, going to school, going to church. We don't see much of that these days. And so I just want you to know that if I, do sound emotional, it's because it is very personal to me, because these are the streets that I was raised on. And now to see something that I don't at all see as familiar, it is very, very difficult. I see a lot of grief. I see a lot of crying. I see a lot of terror in the eyes of people. And so I am doing my best to see how we can make sure we navigate our community through these moments, because it's certainly a tough moment for many. But I want to thank you all for your not just compassion and empathy, your leadership, because we lean on our faith-based leaders a lot for these moments to get us through. But we also are going to be feeling the fiscal impact of this, because I see a lot of businesses that are closed. I see a lot of businesses that are open but empty. And so we are going to see the consequences of this very soon, because these are people who conduct commerce. These are people who are part of our labor force, who are now not there and not present. So I'm very concerned for us, because as it impacts, and the nexus to our commission is people are not going to have monies to pay their rent, pay their utilities or groceries, and there is going to be a relationship to seeing more people fall into homelessness, and that is a concern of ours always. So I just want to thank you all for doing what you all have been doing, which is in your own spheres of influence, just hoping that we navigate through this in a way that makes some sense, because I don't see the logic in this. But maybe that's just me. But I do want to thank many of you who've reached out to our office, reached out to our mutual residents that we all serve here for your thoughts. And I spent the past few days in Sacramento speaking to our legislators, people outside our delegation, because I wanted them to hear the Orange County story. We're the only other county outside of Los Angeles to have National Guard stage here. So I don't know why we were so unfortunate to have that. We are not an unpeaceful people. We are peaceful people here. We are hardworking people here. So I don't get the logic, but many others didn't either. So in any event, my apologies for that editorial. I wanted to make sure that I was on record as you all came into this area and this part of my district to come join us at this commission meeting. But I did want to share just a brief, background on how our office is feeling, because we're fielding some really unsettling phone calls from people and some things that we can't address, unfortunately, but we can certainly do our best to try to inform and share information and try to refer people to the right agencies and resources. So in any event, back to the meeting at hand. It's not a very long agenda, but if anybody wants to share anything, feel free at any time. This is a very fluid commission. I feel we're amongst friends. I feel we're amongst people who care, and reasonable people. We all know that, there are things that are within our control, sometimes outside of our control, but I respect all of you and all of your thoughts on what we've done in this commission, but now just going forward on other issues as well. So with that, I know there's going to be a little break for us to be able to have some commissioner comments, and I'll make sure that you all have an opportunity. But just to get through some of the housekeeping stuff, the agenda for today contains a brief general description of each item to be considered, except as provided by law. No action shall be taken on any item not appearing on the agenda. The Commission to Address Homelessness encourages public participation, so if you wish to speak on any item appearing on the agenda or during general public comments, please complete a speaker request form and turn it into the clerk prior to reading the item. Speakers will be given up to 3 minutes to speak, and the clerk will run the timer and announce when your time is up. Public comment may also be submitted electronically by emailing response@ocgov.com. And with that, we will move to the roll call. Madam Clerk, if you'll please call roll.
Thank you. Commissioners, please indicate your presence when I call your name. Commissioner Sarmiento,
Here.
Commissioner Wynn, here. Commissioner Vanderpool, Commissioner Kim, Commissioner Rose, Commissioner Parks, Commissioner Hawley, Commissioner Bustamante Pixa, Commissioner Hurst, Commissioner Davis, Commissioner Cunningham,
Here.
Commissioner Ivins, Commissioner Spitzer, Commissioner Afable, Commissioner Penniman, Commissioner Bruno Nelson, Commissioner Rios Faust, Commissioner Morse. Thank you, and Chairman, we do have a quorum.
Thank you, Madam Clerk. And as a reminder, please be aware that the room is hot mic'd for the live stream of the meeting. Additional microphones are placed on the table in front of you. Commissioners, please speak into the microphone so it may be picked up for your comment for the live stream. And please try to keep side conversations to a minimum because they'll be picked up by these mics that are very strong. So moving along to public comment, at this time we will take a comment from the public from any members wishing to address us on non-agenda topics that are under the subject matter jurisdiction of this commission. Madam Clerk, do we have any requests to speak?
We do not have any requests to speak.
Thank you. We'll move along to commissioner member comments, and I'll go ahead and open it up if there's any members of the commission that would like to make any comments for those of us here. Yes, Commissioner Cunningham.
Well, good afternoon, everyone. First of all, I would like to support you in your opening remarks. It is trying times, it is scary times, and especially for even those that are at the Family Care Center in Orange. One of our 4 pillars is providing shelter to people in our community. And some of you may or may not remember, a couple of years ago, I came and presented in front of the commission about the challenges we were having finding sustainable operational funding for the care center. And this commission and many people in our community stepped up at that time. And HomeAid is still facing those challenges, although we have made great strides. Obviously, money coming from the County of Orange and the continuum of care and many of our private funders, that is still a challenge that we are facing. And I just want to make sure that I make a public statement that we do not want to see families facing homelessness because we could not keep the care center open. So thank you to those in this room that are in that fight with me, but we still have a long way to go. So thank you.
Thank you, Madam Vice Chair. Any other comments from members of the commission? Yes, Commissioner Morse.
Along with your, to back up your statement, wearing one of my other hats as a member of the Life on the Streets Ministry over the weekend, we had a very extreme shortage of the regular number of people there because they were just afraid to come out. They weren't able to come out to get breakfast, have a shower, get a shower. Didn't want to be seen. People knew where this gathering was and they knew they couldn't come. And that is a very sad day.
Thank you, Commissioner. Commissioner Ivins.
Yeah, this is kind of homeless related. However, I just want to mention we have an upcoming crisis intervention teams international conference coming up in the city of Anaheim in August. It's about the same time our next commission meeting, 11th, 12th, and 13th. And there's a lot of great topics, and we are actually going to be teaching a part of the conference on psychiatric advanced directives. Captain Berryman's going to be teaching that section of the class. There's a lot of homeless topics. You know, mental health is all obviously involved. You know, a lot of homeless people are suffering from mental health issues. So I know it's during our next commission meeting, but if anybody gets a chance to attend the conference, it's a great time to network with people in our, industry.
So if somebody ditches our commission meeting, we'll know where they are.
I'll probably be there.
The commissioner's great, or the captain's great. We've been out in the field together, and thank you for doing that. Any other? Commissioner Parks?
Yeah, thank you. And again, echo the concern of what's going on here locally. And yes, keep us posted how we can help. I do want to say this is kind of more public awareness. I don't know if anybody's followed the story of the artist Chapman Hamburg, if everybody's seen it, but it's kind of amazing. He was walking his neighborhood in Huntington Beach and his infant child with him. And he was a sleep-deprived dad, and he was walking around, and a neighbor called and to the police to say a homeless man had a baby outside. And they followed him to his house. It actually has a happy ending in this, but he showed his ID. His wife confirmed that this is his house. He lives here, et cetera. And he is just such a good spirit about this. But he posted about the experience and then just kind of challenged people to say, so what does being homeless look like? And, I was walking around my neighborhood and it sparked, I think it's, don't quote me exactly, although this is being recorded. It's like 40 million views, right? It's incredible how viral it's gone. But anyway, he and Bex Hayhoe from our team are having a conversation about this, the perception of homelessness and how maybe challenges of art and thinking differently might help get more people engaged. So it's this coming Saturday at 9. And if you want to see where it is, it's on our website. But it's, he's taken what could be considered a negative, and he's turned it into this beautiful way for people to become more aware of our homeless neighbors.
I love that. Thanks for sharing that. Any other comments from the commission? Well, thank you. We're going to move along now to the discussion items. Madam Clerk, if you'll please read the first item.
Item 1 is the Commission to Address Homelessness update, which includes a membership ad hoc update, and we have no requests from the public to speak on this item.
Great, thanks. Doug, I'll go ahead and turn it over to you.
Yeah, thank you, Chairman. Good afternoon, everyone. Doug Beck from the Office of Care Coordination. So for this item, we just have one update, which is our membership ad hoc update. For those of you that remember, we've created a new membership ad hoc for this year's vacancies. We have roughly 11, and we've charged that ad hoc with 2 tasks. One, helping us run the recruitments and provide recommendations up to this commission for those vacancies. And the other is to help us adjust the application for membership. And the focus really is, as you all are aware, we just exited an exercise of updating our bylaws. And a big portion of that exercise was ensuring that we're doing a better job articulating exactly what we'd like to see out of this commission and the roles, responsibilities, and expectations of those members. So that ad hoc has met since our last meeting, and we are currently reviewing. Yet again, we're not looking to make the application incredibly long, but we wanted to add a few questions. And the ad hoc has 2 final draft questions, as you can see up here, really asking about the unique skills, experience, and perspective that one would bring to this commission, and then understanding how they would use their role here to bring together diverse partnerships. So as the commission being advocacy advisory body up to the board, but also one where it looks to bring together a group like this to ensure that the guiding principles, our pillars, and other research that we do is shared not just with the County of Orange, but all of the different stakeholders here in this room, and is brought in into those sectors. So, folks can see those questions up here, and then here you see we have 11 expiring or vacant seats that we're looking to fill. We've had a few moments in history where we've had a handful of vacancies at the same time, never this much, but I want to remind the group, the reason we have such a large amount of expired seats is because we did not want to recruit for seats while we were undergoing our review of our bylaws. So we understood that at the end of that exercise, due to running that exercise, that we would have a handful of vacancies. So we've expected to be in a situation like this. So with 11 vacancies, we are breaking it up into 2 phases of recruitment. As you can see here on the timeline, we look to run and start a recruitment, launch a recruitment after this meeting, which will stay open for several weeks. When that recruitment closes, we'll reconvene the ad hoc group. They will review the applications, and in our August meeting, that ad hoc will come with recommendations for those seats. If they get approved, we'll then bring that up to the Board of Supervisors for final approval. And then we will repeat that same cycle starting in August with the second recruitment process. I also just want to make it really clear, when we launch a recruitment in a few days, we will make sure to have that recruitment on our website. We will be sending out information on our listserv. We will be reaching out to all of the commission members, and we will also be sending it up to all of the supervisors as well. We really, for obvious reasons, want to make sure that the posting of those recruitments are spread widely in order to get the most qualified and robust applicants. With that, I'll pass it back over to the chair.
Thanks, Doug. Let me go ahead and ask any members of the commission if they want to share anything on this. By the way, I do want to thank Commissioner Spitzer, Bruno Nelson, and Ivins and Morse for being on that ad hoc and helping us work through this, so appreciate all your time. Any questions or comments on this discussion item? Seeing none, thank you, Doug. Madam Clerk, if you'll please read the next item.
Item 2 is the Office of Care Coordination update, which includes updates on OC outreach and engagement, the OC Same-Day Solutions Fair, the 2025 Homeless Survey, and the Homeless Housing Assistance and Prevention Round 6. And we have no requests from the public to speak on this item.
Thank you, Madam Clerk. Doug, I'll go ahead and turn it back over.
Yeah, thank you, Chair. So our office has a handful of updates, as the clerk just read, and we're excited to share each one of them. Many of you may be aware that during an April Board of Supervisor meeting, the board essentially approved the transfer of OC outreach and engagement, which currently lives in our healthcare agency, for that group to move into the Office of Care Coordination and the office that I'm the director of. That will be effective July 1st. We are really excited about that transition. We've been working really closely with the healthcare agency and the outreach and engagement team currently to make sure that that's a smooth transition. We believe that having outreach and engagement under the Office of Care Coordination provides a more seamless continuum of services and care that the county provides. Our office currently oversees our 2 county shelters, the other about a dozen or so that we help provide funding to, our continuum of care. This commission really spearheads so many of the homeless service initiatives, and bringing O&E, which is such a vital service and one that is really the front door to help and services for so many into our shop is something we're really excited about. What I want to mention as well is that we hope that those outside of our, outside of the Office of Care Coordination and O&E see this as a seamless transition July 1st. So what I mean by that is our plan is to continue to operate the same hours. You could still reach us at the same phone number. For the many partnerships and commitments we have with different cities and stakeholders, we're continuing those commitments. We still have a mission of being out there and engaging and helping every unsheltered homeless individual on the street that we can find. And as as time goes on, I'm sure we'll, like with any transition, have some adjustments and modifications of the program, but starting July 1st, people should feel that it's business as usual. The last thing I'll mention is what you see up here is the current outreach and engagement branding. we've finalized a rebrand, which we haven't made public yet, and we haven't shared with our outreach team yet. We're going to do that next week, so we didn't want to, sort of get out in front of it. But you will see, and we will share widely in the next week that new branding, just so folks, because so many people are familiar with OC outreach and engagement being synonymous with the blue shirts, being synonymous with the healthcare agency. And with that branding change, we want to make sure people are aware of the changes and what that looks like and what to expect. So we're excited to share that in the coming week or so. Same Day Solutions Fair. So as we presented on last time, we had an incredibly successful pilot Same Day Solutions Fair in the city of Santa Ana with the partnership of the city of Santa Ana and the city of Garden Grove. And our plan has always been to have this a regular event. And for those of you that are not currently aware of what the Same Day Solutions Fair is, it's essentially a fair that we host on a regular basis in partnerships with different cities that bring together all of the different resources that someone experiencing homelessness may need in order to improve their situation and hopefully move closer to ending their homelessness. And what I'm excited about today is that we have essentially 3 cities lined up for our next set of Solutions Fair. We're working really closely with Commissioner Rose on a Lake Forest one. I'm really excited. That will be our second. So hopefully we'll have something in the summer. I just had a meeting with the city manager of the city of Orange, Tom Casella, who used to be a commissioner on this commission. They're excited to host a Same Day Solutions Fair. We're so incredibly early in the planning, but our office is really eyeing early fall for that one. And then we've been in discussions with the city of Costa Mesa in a very initial way, and they're excited, and I think we'll probably do that one further in the year, just because as much as we'd love to do them back to back to back, obviously there's staffing resources and things to that nature that prevent us from being able to do it at such a quick cadence. But moving forward, we'd like to, our strategy is that we will, rotate each Same Day Solutions Fair. We'll go in a different spot each time. So our strategy is to always have the next location in a particular spa lined up. So we have 3, and I'm hopeful by our next commission meeting we'll either have just completed our one in Lake Forest or close to it, and then we'll have specific dates for the city of Orange and the city of Costa Mesa. 2025 homeless survey. So we've briefed on this one as well over the last couple of meetings, and those of you who've been on the commission for quite some time are familiar, and this commission is really was the spark to our office conducting more robust surveys during our off point in time count year to really get an understanding and to be able to ask questions to the population that the point in time count just doesn't allow us to do. So it is really a year-long effort. And we've been working with our partners at CityNet here at the county and the Hub for Urban Initiative since late September, early October, around conducting a survey out in the community focused on understanding really people's journey into homelessness. And when I say that, I mean that very specific time of their life, asking questions about their situation right before they started experiencing homelessness, and that time when they started experiencing homelessness, asking about service, service engagement, interventions that they sought or had wished to seek. And we're really excited that CityNet the survey was between 50 and 70 questions based on each person's situation. they were able to collect 840 surveys in the month of March, and that spanned across Orange County and was done in an equitable way based on each city's 2024 point in time count, seeking to survey 20% of each city's unsheltered 2024 point in time count. We've been working really hard, as you can imagine, 840 surveys, each one of them answering 50 to 70 questions. It's a lot of data. So we're excited that we will be sharing the results of that survey here at this commission in August. Our timeline for that is to also share the results at our continuum of care meeting the following week. And as many may remember, at the start of this process, as we developed our survey, we did something unique, which was we held a joint meeting between the commission and the COC. It was a special meeting that reviewed and provided really valuable input into the creation of the survey. And one of the wise suggestions at that meeting was that that group should be brought back after we had the results. So that group could really opine on the results and talk about next steps and to-dos. So what we plan on is, like I said, we'll do, I don't want to say a brief, but a somewhat brief presentation here in August. The same brief presentation the week later at our COC commission, our COC board meeting. And then in early September, we're going to schedule that joint meeting where we dive into the results even further and talk about, next steps and takeaways. And then I'm going to hand it over to my colleague Zulima Lundy to talk about HAP Round 6.
Thank you so much. I'm Salima Lundy, the Director of Operations of the Office of Care Coordination, and I am going to be providing a brief presentation on the HAP Round 6. This is a state funding program that we have previously presented to you guys, especially around the process that it takes to apply. Just as a little bit of background, we are on round 6, meaning that for the last six years through the state budget process, there has been an allocation of funding that has really provided regions with an ability to create and expand new homeless service programming, either shelters, permanent housing, street outreach, supportive services in different capacities. And that funding has largely gone to the big cities and also the counties and the continuums of care. So this table here provides a detailed allocation for all the 5 rounds. You would note that the city of Irvine became a big city during round 4. And really, today's presentation focuses on the HAP Round 6 timeline. So during the 2024-2025 budget process, the HAP Round 6 funding became available. And since then, the state has worked to develop the Notice of Funding Opportunity and the related requirements. So the application became available earlier this year in February, and we have to submit our final application by April 29th. And from there, we can expect awards to be announced all the way through the end of the calendar year. In this HAP Round 6 funding, we have to apply as an Orange County region. So that would include the County of Orange, the Orange County COC, which our office functions as the administrative entity, the City of Anaheim, the City of Santa Ana, and the City of Irvine. And these are also the respective allocations for that funding. The HAP Round 6 funding requirements, although the state likes to say that it has been simplified and it is not burdensome on communities, it has actually a lot of different steps and components that we must complete in order to be able to draw down that funding. The 2 biggest components being that we have to complete a single regionally coordinated homeless action plan that really builds on what was previously submitted on round 5. And this homelessness coordinated action plan really looks at system performance metrics and the strategies that communities will be implementing to improve those metrics. It also requires a memorandum of understanding that details how all the jurisdictions who are receiving HAP Round 6 money will be working together in the use of that money. And it also sets requirements around administrative costs, the minimum amount of funding that can go towards youth programming, and also details the requirement to have a community engagement process. So this slide here provides further information as to what is covered in the Regionally Coordinated Homeless Action Plan. These do become available and are posted on the state website and also the Office of Care Coordination website if you guys are interested in learning more. But really, my ask today is to invite you to be part of the process. I'd also want to take a moment and note that the HAB Round 6 eligible use activities continue to be in alignment with previous activities and really focus on permanent housing solutions, homelessness prevention assistance, interim housing solutions, which includes emergency shelter, transitional housing, bridge housing type of programming. And non-housing solutions, we really looks at services coordination, supportive services that help people achieve housing stability and also increase their income. As mentioned, the community engagement process and the plan development are really key. So if you guys want to dive deep into the Homelessness Regionally Coordinated Action Plan or learn more about the HAB Round activities, we want to invite you to participate in these 3 community sessions, or maybe only one of them. The first session is going to be hosted by the City of Santa Ana. The second session is hosted by the City of Anaheim. And the third session is hosted by our office. We will be supporting each other by attending all the different sessions because we are working together as one region in the submission of this plan. But this is also an opportunity to learn more. And that concludes my presentation.
Thank you, Doug and Zalima. So let me go ahead and just bring it back to the commission to see if there's any questions or comments. There was a lot there. So, a lot of good stuff and a lot of important information. Commissioners, any questions or comments for Doug or Zalima? So I just don't want to miss this, this sort of changeover from HCA to your shop, Doug. So how many people are we talking about here, actually?
So we're bringing on 56 positions. So what I would mention, because I think it's really important, and I'm excited about that 56 number, but
be careful what you wish for.
Yeah. The O&E is currently 88 folks, and it's largely funded through MHSA funding and serves specific roles. One of the motivating factors was the changing landscape in MHSA to BHSA funding. So I mention all of that because there's a specific function that HCA still needs to fulfill. So I'm receiving 56 folks. They are retaining 32 positions, creating a program called BHS Navigation, which is exciting. But I mention that because I know for myself, I have to continue to remind myself, and the staff reminds me that even though we're getting it, it's a slightly smaller group than what it is today. But I'm really confident that the reduction in that number won't be felt other than in-house. So.
Well, I think it's a big deal, but operationally it's going to stay the same, right?
Yes.
So they're going to continue doing the same, serving the same function. You're just going to be a lot more exhausted because you have a lot more to oversee. So when you come in here, we'll be patient.
We'll appreciate that.
We'll appreciate that.
Yeah,
on the survey, so you said 840 individuals were surveyed. How many of those were sheltered and
so
those unsheltered?
all of them were unsheltered. So it was 840 folks experiencing unsheltered homelessness. And obviously we received sort of the initial data, and it's just really interesting. The 2 things I'll preview is that one, it continues to demonstrate the variety of paths that people take into homelessness and how dynamic everybody's situation is, especially around the time that they fall into homelessness. And then the other thing that I'll mention is that, I'll mention 2 more things, is that our initial read-through the data is really similar to the results align in many different ways to what we saw on the UC San Francisco study about 2 years ago that was conducted statewide, and we had one of the co-authors down here to speak about it. And then the one data point that I'll share that just strikes me the most is it appears that only 12% of the respondents stated that they sought help before they became homeless, which was shocking. So really, really interesting data to come. Concerning that so few folks, sought help before experiencing homelessness.
Yeah, I guess and that begs the question as to why.
Yeah.
Right? Is it because we're not getting our information out there? Do people not believe there are resources? Are they so hopeless at that point? Or, maybe just in, some condition that prevents them from trying to remedy the situation? I don't know. Maybe that's sort of a good follow-up.
Yeah, and not to go further down the rabbit hole, but what we're seeing is that I think some of the folks didn't really, that transition into homelessness was really quick. And then the other thing that we're reminded is that many of the folks that we engage and that are experiencing homelessness on the street, to your point, Chair, I don't think we're incredibly aware of the resources and how to get them. So, yeah, we have a lot of data to look at, and I'm interested in hearing everyone's interpretation of those results because, unlike the study we did in 2023 where we were looking at people's experience in the system, and the results were pretty straightforward. The data we received, as I've mentioned here, is really dynamic, and I think very much so. Like any good survey, it leads you to more, just as many questions as it provides answers, and it provides us hopefully with direction to go in terms of further questioning.
Thank you for that. Last comment for me is, it's great to see on the HAP round 6, there is a transitional piece. We know that, the 3 cities are getting their funds, and we, I guess, through the county and then through the COC get, I guess, an aggregate of about 17 million. But to see that we have needs at the emergency shelter level, permanent supportive housing, but there's that big delta between the two. And yesterday in Sacramento, one of the things we learned is there are a lot of small scale homes that are already sort of ready to go. They're just looking for a home and looking for a place. And I think at one time they were set to go to San Diego, and there was a deal ready to be done, and then the site, fell through. So they're sitting with a lot of prefabricated units that they're ready to work with any county or city. And as we know, the challenge usually with these developments or proposals is siting it. Which city would be willing to go ahead and take it into their community? But we had a lot of good discussion with some of our faith-based leaders who were looking at SB4 and seeing how that maybe a small scale development could be done on a faith-based or worship campus. And I know we saw one in Yorba Linda, I believe, and it was done well. It was more of a permanent supportive housing unit, but development, but they were certainly open to doing something on the small scale. So more to come on that, but it's good to see that as part of our HAP discussion. So thank you, Doug and Zalima. Madam Clerk, if you'll please read the next item.
Item 3 is the Commissioner Spotlight with a presentation by Benjamin Hurst, Managing Director at the Salvation Army. And we have no request from the public to speak on this item.
Commissioner, the floor is yours.
What an extraordinary time. Thank you for the opportunity to share about what the Salvation Army is doing in the homeless landscape in Orange County. It's an honor to be here today. It's an honor to have served on this extraordinary commission. So I thank Doug and the chair for this time. And I thank you that I get 20 minutes, not just 5 because of the short agenda. Thank you for that. Just kidding, Doug. Little brevity. Exactly. I have a deep conviction our community is capable of extraordinary things when we come together. And in 2017, the Salvation Army was offered $75 million for our 14-acre campus off of Catella in Anaheim But we were a community in crisis. And I applaud top Salvation Army leadership at that moment for deciding not to sell out and turn our back on 2,000 homeless people camped along the riverbed in Santa Ana, but instead flip the script and take that 14-acre campus in Anaheim and turn it into what for the Salvation Army is one of the most comprehensive homeless care campuses in the United States. So in 2018, we struck a partnership with the city of Anaheim that's been, I believe, really transformative. And we opened the Anaheim Emergency Shelter and turned a dirt lot into 224 beds in just 79 days, and really caught lightning in a bottle as the community came together. And through that extraordinary group effort, we expanded it by 100 beds right in the middle of COVID to where it's 325 beds today at the Anaheim Emergency Shelter. And I'm thrilled to report to you, as we celebrated at City Council together in Anaheim last night, that that shelter has served over 1,780 unduplicated residents. It has provided an aggregate of over 500,000 nights of shelter, 400,000 meals served. And like most of our navigation centers in the community, there's one-on-one case management for the residents. It's provided over 15,000 one-on-one case management sessions. And working collaboratively across the community, we've been able to house almost 500 of those residents in permanent housing. So we are just thrilled. What an example of what can happen when we roll up our sleeves, get to work, blow through red tape, and come together. And that's one example of the 720 beds the Salvation Army provides the Orange County community serving the homeless, including shelters, not just in Anaheim, but in Placentia, and also a facility serving the community of Santa Ana. So next slide, please. Thank you. So that 14-acre campus is the heart of what we're doing in Orange County. We affectionately call it the Center of Hope. And in the upper right corner of the slide is our homeless throughput system baseball diamond that nationally within the Salvation Army has become famous and controversial. It's loved and disliked in both ways. And I tell people when they reach out, say whatever you want about it as long as you're talking about it, because that means you're talking about solutions for homelessness. Isn't that right? So what we did is we had a dirt lot, 7.5 acres, and we said together, look, we've got a blank slate. What kind of high impact, strong horsepower programming can we bring into this space from nothing and really create a flow system, a throughput system to get people off the streets, compassionately cared for, strong, housed, living autonomously, living victoriously. That's the throughput system. So on that campus, you've got a 325-bed low-barrier shelter. You've got 72 units of permanent supportive housing at our Pathways permanent supportive housing apartments. We've got a 175-bed drug and alcohol work-based therapy rehabilitation center. And then right at the heart of that, you see CARI, CARI, which is the Center for Applied Research and Innovation. Next slide, please. So as we were putting the Center of Hope together, we reached out nationwide, wanting the very best the Salvation Army has to offer for homeless help. And we were surprised to realize that even though the organization is over 160 years old, it's in 132 countries, we've had our flag taken to the moon and back, there is not a dedicated social science research and program design center anywhere in the world. And we said Orange County can lead the way. We can step into that space. So we have put together the world's first Salvation Army Center for Applied Research and Innovation, the acronym CARI. And we're super excited about that because we can research through real-time data on our 14-acre campus. We can program, design, and iterate We can deploy rapidly. I could get a program from a whiteboard to the field in about 45 days in my space. That's huge. And then we can share it instantly, nationally, across a network of 6,914 service centers. So when I talk to community partners about a desire to change the world and change the story arc of homelessness, I talk to them about the ability to think breakthrough thoughts, high impact thoughts, innovatively and out of the box, and then have a network of service providers instantly ready to roll up their sleeves and get to work. And that captures the imagination of the community about what could be possible. And it's that conversation that's propelled our capital campaign, just conversationally, so we know. We've been in about a 4-year, $65 million capital campaign that's 93% done. We've raised about $61 million, which is fantastic. And I'm thinking about Commissioner Spitzer's comments. Again, I referenced it the other day about how if we get a bold plan, the community will rise up and help and do great things. We've seen that at the Center of Hope. We're working right now on some cool things research-wise. We've got a grant for virtual reality therapy for the homeless using virtual reality technology. We're going to be doing this fall. We've got a grant for researching advanced robotic use in a homeless shelter. We're actually introducing a AI-driven sonar adaptable robot dog at the Anaheim Emergency Shelter this summer. In fact, if I'm back this August, maybe I'll bring it by and introduce it. And then we do a lot with AI, of course, like all your teams do these days. And when Doug reached out and invited me to spotlight today, I carved just a quick minute out of my time, and I created a research prompt for an AI tool about a page long, and plugged it in to Gemini's new deep research tool and put it to work, asking it to analyze the homeless situation in Orange County, come up with a strategic plan, come up with key performance indicators, come up with a budget, come up with a timeline, and evaluate its effectiveness. And it came up with a 53-page report. That's spectacular, isn't it? By the way, I've not read this, Doug, but we're living in an extraordinary age, aren't we? Where all things are possible. But in all sincerity, thank you for that last slide. Most of what we're doing at the Research Center and Center of Hope is not tech-driven. It's human relation, soft skill research and program work. And one of the things we are really most excited about is we've been working for 2 years on this breakthrough idea of taking medical detox and high intensity and low intensity residential substance use disorder recovery for the homeless, powered by Medi-Cal, coupling it with animal-assisted therapy through a pilot we've been working out through my work at USC, marrying the two ideas together and scaling it large at Center of Hope. So we are excited to announce to you today that we are working super close with Commissioner Vanderpool's team at the City of Anaheim and also at the County Behavioral Health Department about a bold $90 million, 168-bed new construction proposal on the California Prop 1 Round 2 due in October. So join me in cheering for that. I just came back from Sacramento and met with 9 of our elected officials, and there's super excitement up there for this kind of scaled proposal that could really get in that homeless substance use disorder space and see breakthrough. And there's excitement even in the County Behavioral Health Department. I spoke briefly with Dr. Veronica Kelly about it last week. They're ready to go. The City of Anaheim's ready to go. The Salvation Army's supercharged. And if we can get this breakthrough at Center of Hope, it is a facility that would serve the entire county, all regions. So very excited about that. And as I close, I was thinking on my way in today that 2 years ago, I was invited into the studio of Angels Radio AM 830 because they wanted to hear about Center of Hope. They wanted to talk about homeless, so they had me on the air to interview. So I'm telling them about a lot of the things we talked about just now, and we get to commercial break, and they mute the mics, and they smile at me and they say, Ben, listen, we're on commercial break. Let's talk real. Can people really change? They said, our mics are muted. Nobody will hear this. I smiled back at them and I said, listen, in 1998, my sister was a meth addict. She had arrest warrants in 3 states. She was stealing to support her drug habit and on the run from the law. The sheriff's department showed up at the family house and said, prepare yourself. These stories usually don't end well. But today, she's 27 years sober. She's a wife. She's a mother of 5 beautiful children. She is the chief financial officer of a hospital in Washington State. We can reach higher. We can reach further. Thank you for the privilege of sharing today and serving on this commission. God bless you.
I thought you were going to say, Commissioner Hurst, that they were going to offer you a job as an announcer. You know, that delivery was great, and thank you in all seriousness, Commissioner, for that that incredible presentation. I'm sure that when you went up to Sacramento, you let them know this is the first, not in the country, but in the world, of this type of campus in this effort. So thank you for that. Let me go ahead and see if any of my fellow commissioners have any comments or questions.
That's okay.
Please, Commissioner.
Thank you very much. What is the state of our detox beds today? Since Be Well, at least Be Well Orange is not operating, we lost those detox beds. And I understand the Salvation Army, you have other detox beds, correct? So are you feeling, from the county perspective, how many detox beds are available on a daily basis, all in?
I don't speak, of course, for the county. I can tell you our dialogue with the behavioral health department team. There's an urgent need, especially for detox beds, especially accessible to our homeless community. Salvation Army has a 175-bed recovery program, but it's work-based therapy, so not everyone can get in there. That is why we've designed a new program to come alongside it that's really tailor-made for our homeless population.
So, Michelle, I don't know if you know this or somebody, but assuming we get that grant, or you get that grant, you build those beds, how many beds do we have in our inventory? Is Be Well Irvine going to have detox beds?
My understanding is yes, but that's not quite open yet.
Right. What about, is Be Well Orange going to reopen at some point?
Yes,
And would those detox beds come back online?
yes.
Okay.
I don't know the numbers.
No, that's fair. I wouldn't expect off the top of your head.
I think what I would say, right, is we do our assessment on a regular basis. You know our process, right? Strategic financial plan.
Yeah.
So anytime we have a gap, we're working with departments to try and close that gap, whatever it's related to, whether it's substance use, other types of beds, right, which we've been working on, and I could speak to that, but yes.
To Commissioner Hurst's point, though, we're seeing that in the Prop 36 court, right? We're trying to keep people from becoming homeless. And if you can get them through detox and go from, if they agree to detox, which for a lot of addicts, it's a very, very difficult process. The withdrawal process is painful and presents all kinds of emotional and physical issues. I'm just saying, I've heard this for a long time. I think that's why I was really happy when Be Well Orange got detox beds. But the detox beds are, I think we all agree, they're critical as a safety net to help us keep people from getting to the street because they're addicted and stealing, like his sister's story. So this is amazing. I just want to make sure we also have the county detox beds that we already paid for.
I can just add, since you did mention Prop 36, right? It is through working together that we have the ability to make a change, because we had our Prop 36 related meeting, right? And we were saying there were some challenges. I inserted myself after the last OCC/JCC and then was able to authorize the fill of 4 behavioral health positions within HCA,
Okay.
right? It's like
Yeah.
move, because that's where the holdup was, right? The delay was because they didn't have sufficient staff to be able to do the assessments. So that will be moving, right, sooner than later. So, but it is through the communication, which is so key.
Yeah, just to fill in that so we staff the Prop 36 court, DA's office, public defender. Probation's not there, they're not part of Prop 36, but healthcare agency comes in and assesses the individuals who are being offered Prop 36 as opposed to jail. That's the whole idea, get people into treatment. So healthcare agency had 2 representatives in our courts, but they needed more and the court wanted to open up another courtroom. They had a Friday courtroom, they wanted a Monday and a Friday. So we didn't have the staff to do the assessments. And if the assessments are delayed, then, right, all it does is build into your cake more delay, which you cannot delay people when you're offering them treatment. And at least you have the carrot and the stick. Jail or treatment, and we have their attention. And we want them to go treatment. So I want to really thank our CEO for working on that, because I talked to her and Dr. Kelly and others and said, hey, we've got to get more healthcare assessment experts in our courtroom so we can get people into treatment. And Michelle answered that. And I'm very grateful, Michelle, because I was aware you did that. And I think everybody understands how important that is to the success of Prop 36, but most importantly, people's individual addiction issues. So thank you for doing that, Michelle.
Thanks for those comments. I do think it's fair to ask what the inventory is of detox beds and just to understand what our capacity is. We shouldn't say, even if the success of the application here is not going to be the baseline, it is going to be a complement to hopefully what already exists here in the county. So we certainly think just having an idea of what the inventory is. I didn't support Prop 36 for the record, but I certainly want it to be successful now that it is law. And so to the extent that there is divertible individuals that will accept that option and that will, assume that responsibility, we want to make the resources available just so they can be successful. But yeah, I do thank you, Commissioner Hurst, for all your work. I mean, sometimes looking at this, and I'm sure legislators that are outside our county, when we talk to them about what we're doing here, they really are pretty stunned. I mean, because they, for whatever reason, don't see Orange County as an innovator. And I always bring it back to them and tell them we have a really active philanthropic, nonprofit network of people that do incredible work, and those in our faith-based community. But they also, I always remind them, we get 5 cents on the dollar compared to all other counties, right? So we're working with so much less just at the outset. And other peer counties or counties, of the same, population size or similar are getting twice as much and sometimes 3 times as much, right? So we still tell that story, but, for those who, I mean, the timing is completely bad, but it still is helpful to remind them that the county is also changing. The county is evolving. The face of the county is changing. It is not what they see Orange County as an affluent, wealthy county, a donor county that has no needs relative to the other counties in the state. And when I describe my district and the demographic of people that live here, they're shocked, right? And maybe it's because, the messenger's changed. So when they see a person like me looking at it from a different lens, they respond differently. I can tell them through lived experience, this is what our county is looking like more and more. And I'm proud of it. And they are very welcoming, but they are also stunned by the fact that they have a different impression of what the county of Orange is. And so we're changing the narrative a little bit. So thank you, Commissioner Hurst, for that presentation. Madam Clerk, if you'll please read the next item. I think we're on presentation still.
Yes, item 4 is a presentation titled Warm Program for Families, presented by Madeline Hernice, Chief Executive Officer of Families Forward, and we have no requests from the public to speak on this item.
So before I turn it over to Madeline, I just want to say at the Board of Supervisors meeting in January, I introduced the weather-activated rooms, known as WARM for Families program, to provide motel stays during cold and inclement weather for families experiencing unsheltered homelessness in the 2nd District. So I allocated some discretionary monies to pay for hotel rooms, food assistance, transportation, and operations and administration of the program in order to connect vulnerable families with additional housing and social service resources. So the WARM program was administered by the nonprofit Families Forward, who's with us today to present. I'm extremely grateful, and the families, and I got to meet with some of the families that we worked with. I know we worked with some of our school district offices that helped us connect to those families that needed the support, and the stories were really compelling. The gratefulness that they showed for the program was really just heart breaking and warming at the same time. But I just want to tell you, a lot of that came from this commission because, as you all know, we were trying to figure out, what do we do? Are we going to stand up what was called a cold weather shelter and maybe stage it at one of the armories in either Santa Ana or Fullerton? We opened it up to cities and to see if they'd help out. We didn't get any takers, so this was sort of the result or the consequence of that. And it was also a way to see, did it work? Was it successful, and what were the results? And so with that, let me go ahead and turn it over to you, Maddie, so you can go ahead and share some more with us.
Well, thank you. I appreciate it. Good afternoon, commissioners. Obviously, Chair Sarmiento, Vice Chair Cunningham. I appreciate the opportunity to be here to share about the WARM project. Like Supervisor Sarmiento shared, and to his points earlier about innovation, right? Even when we had the cold weather activation, we didn't really have a space for families with minor age children. So how can we look at things a little bit differently, a little bit more creatively, and then how can we learn from the experience to see if there's an opportunity to do this again and to do it even better next time? For those of you that don't know me, I'm Maddie Hernice. I'm the Chief Executive Officer at Families Forward, and I am joined by my incredible colleague, Nishta Mohendra, who's our Chief Program Officer. So she will bail me if you guys have some really tough questions. But I wanted to share a little bit more about Families Forward and just share a brief video about who we are before I talk about the program. So if it's not clear, we are committed to families. The work that we do is to prevent and end family homelessness. We know that the number one indicator to experiencing homelessness is having experienced it in the past. And as you can imagine, many parents in our program have experienced housing insecurity. So in order for us to break this cycle and to really focus on the children that are experiencing housing insecurity and homelessness, that is the work that we do. And we do that by providing access to housing and resources that create lasting stability. Here's a brief presentation agenda. I won't go and read you everything, but we'll go over the program, kind of how it came to be. What are the activation periods that we experience? What are some of the challenges? What's the impact? What's the success? We really want to be transparent in this process because we do see an opportunity for this to be even better if it were to come again to light. We see today that on average, the families that are experiencing homelessness are waiting 4+ months, if not longer, to even get into a family shelter bed. And we know we can do better as a community. So as was shared, the idea was to really target from the school district. So working with our McKinney-Vento liaisons, as they identified individuals and children that were in their schools. So we're only talking about enrolled children that were experiencing housing insecurity or unsheltered homeless at the time when they connected with their McKinney-Vento liaison. And this was specific to the 2nd District, and we worked with all of the schools. We did a scattered site motel program where we were able to work with, I believe it was 21 different motels in District 2, and to make sure that we had a wide variety of opportunities and make sure that transportation, accessibility, and other barriers were reduced. And of course, making it a low barrier and working within the cold weather activation period from January to April. I will share with you, this was a very quick ramp up of a program as well. So, being innovative, being quick on our feet, learning along the way, in partnership with the school district and of course with the Office of Care Coordination and the supervisor's office. So when we launched in February, the first activation wasn't until February 5th, and we only had 2 families referred. And I think we were all a little surprised by that. But that was one of the first lessons learned in working with the school districts on how active are the lists that are maintained, how accurate are they, how can we make sure that this becomes first and a first point of on mind of the McKinney-Vento liaisons. We saw our peak activity in March with 26 families referred. And then in April, we rounded out the season with another 2 families that were referred over. So this next one here, so I want to give a little bit of context to this. So we had a total of 5 activations, and you'll see they vary in their nights. The minimum night that we were authorized to provide was 2. Depending on the severity of the weather or the rain or how it persisted, we could go up further, but the maximum opportunity that we had was in that 4th activation at 4 nights. You'll see our referrals got better, right? Our partnership with the school district continued to grow. We were engaging with the liaisons, trying to get in between weather activations so that we could make sure that the families that they were working with knew about the program. But then the contact list started to drop off. A lot of the numbers were outdated. A lot of families were not as available or were not as interested in kind of leaving what they had that they knew for only 2 nights of activation. And I think that really created a significant challenge. Many families who were unsheltered originally when they came into contact with their liaison may have been sleeping in a garage or a couch, and to kind of pick up their family and their children just for 2 nights. For some families, it just wasn't worth it. And then the rooms booked, you can see the follow through there and then the total nights that we were able to serve. And like I mentioned, we were able to share or establish partnerships with 21 motels with a total of 27 nights of shelter. So the referral process, as I've already shared, and I'm repeating myself, is the school identification, obviously working to engage with families and program placement. The families, again, multiple channels of communication, working with their liaisons to help do that warm handoff to ensure that families know that we were a safe space to land. As many of you who work in direct service work are experiencing, even over the last month or last 2 months, a lot of families are also changing their contact information, making sure they feel safe, and making sure that those who know them have that right information. So how do we engage with those families and make sure that we can connect and wrap around with the support services? And the support services really started with resource connection. Do all these families know about our system? Are all these families already in our system? If they are in the system, where are they in the system? And really making sure that we can connect with them. Through the families that we served, 17% actually secured permanent housing, which I know seems small. I think, I see that and I say, oh, couldn't it be bigger? But with only 2 nights with these families, I think it's pretty incredible. And I wonder, and I, beg us to think, what could we do if we had longer? We had a longer period of stay with these families during their active crisis and can really connect them. One success story I'd like to share is a father and their 2 kids They're 14 and 16, and they're living in their car in Orange. They were a part of the activation that was a 3-night stay in the WARM program, and they engaged with our team to get connected to the Family Solutions Collaborative. They actually were not a part of the network or part of the system and enrolled in any way, shape, or form. We were able to complete a needs assessment, obviously provided food, transportation, those 3 nights of lodging, and then most importantly, getting them connected to their appropriate access point, which for this family was one of our partners, Spin, serving people in need. And on May 1st, they moved into their apartment in the city of Orange. So it does work. It does work. And we just need to learn from the opportunities and be able to maybe do things differently next time. And then we had 33% diversion success. So we prevented them from returning back to homelessness. As I've shared throughout the presentation, communication, the short stay, and planning constraints. So doing what I can to get my family ready with maybe a 24 or 48-hour notice of a weather activation were part of the opportunities for improvement and how we kind of began to evolve and learn through the process. And then, of course, stay connected to some of those families who maybe were referred in the beginning and weren't really ready or willing to connect with us or drop everything and move into the motel for 2 nights. But how could we engage with them along the way, especially when we had our 4-night stay? And so that's it. That's a little bit about the program. We so appreciate the opportunity to be innovative and to do things differently, and to really look at how families can be at the forefront of some of the challenges that we're seeing in our community. I think it's very often that when we talk about homelessness and we talk about numbers, that families are perhaps not as highlighted. And, I'm here to share that there's such a need in our community. And as an organization, we are experiencing an overwhelming demand for the first time where families are saying, I need help today. And I wish we had enough resource, but I also appreciate the creativity to be upstream and be innovative and work with limited dollars to make sure that we can capture those 17% of families. So I appreciate it and welcome any questions.
Thank you, Maddie, and I'll bring it back to the commission for any questions. But I just want to say, you are being very modest when you say you had very little time to stand this up. It was very short, very brief, and as you all remember, we were kind of talking about this here, and we realized we were kind of at the tail end, and we didn't get a response, and so we just said, all right, we're going to stand up an RFP on this, and sent it out, and you all responded and were successful, and we said, stand it up quickly, and you did. So for it being the first year, I think, the results are great. I think that it was something that, even helping those 27 families that you're talking about, and I guess with the other two on the front end and back end, over 30 families, that's something that wouldn't have happened but for, the work here. So I know we had a lot of challenges where we were told, well, don't do it. We've heard that these, motel voucher programs are not a good idea. The families won't leave the motels. They'll damage the property. Did you see any of that?
Not at all. So we had no challenges, no damages, no incidentals. We had no families that were unwilling to leave when it was their time to leave. Every family was very successful in that. There were no other challenges.
So one of the problems I had when it was just an idea and I was kind of throwing it out there is there's so many people giving you reasons why not to do something. And that was frustrating. And it really was, because I thought, okay, the option is we don't have any, any sort of program to direct people to. So rather than doing that, I'd like us to change our culture here at the county and say, well, look, we know that it's going to be a challenge. Let's figure it out. We have some pretty bright minds here. So rather than saying no first, let's say, well, let's think about it. So I think that's something that we definitely need to change. And I hope that, this is a lesson learned. Maddie, thank you so much for demonstrating that if you do something and it's done thoughtfully and, heartfelt, you can get through. Like, yeah, it's not going to be perfect, but neither were our cold weather shelters at the armories. So, you can't compromise, what is it, the good for for wanting to be perfect. Things are not going to be simple. But yeah, I just do think we need to go into this with a different mindset. None of the stuff that we do is easy, nor should it be, or else it would have been solved. That's why it's at our feet. But let's not start with no. Let's start with let's think critically about how to solve the questions. Thank you so much for the presentation, Commissioner Spitzer.
So what's our Shark Tank? In other words, when you have an idea, where can you go to sit around with a bunch of investors, experts, angels, who can give you advice, tell you to go in this, like, where's that incubator that you're talking, do we have that?
This may be it. I don't know. But, I think a lot of it is wherever we find any sort of, conceptual ideas, ours is, kind of running it up through the CEO's office, through, Doug's thing. And I think here it was the commission really talking about these options that kind of embedded that idea in us, in our office's head. But you're right. I don't know if there is that forum that we've created to
But I thought one of the reasons we're talking about recruiting and doing that long questionnaire and everything was to get people who not only are influential in their own organization, but want to help other people. Like they want to lend their expertise and are going to be part of this bigger solution. I thought that's what we were trying to create here. So, I mean, I love that presentation. I love when people say, hey, what are the lessons learned, right? Self-reflection. So I guess what I'm saying is, Doug, can we figure out how to facilitate not in this forum, but some, event, a lunch or something where you bring groups in who want to talk to, like, the people that are sitting around this table who are experts.
Let me see, which groups are you talking about though, right? And then which funding source are you talking about?
Well, Michelle, I don't think government should be always everybody's first stop for money, ideas, and leadership, okay? And the reason we went through, and I think we're going through this recruitment exercise, is because it is a cultural shift, and I don't think we're acknowledging, like we keep getting these presentations, fantastic, Salvation Army's amazing. Sue, you just had another big event I read about. I mean, you guys are motivating people within your influence spheres, right? But it seems to me, and I think you're eager, I'm not speaking for you all, but it seems to me that you could lend a lot of insight to people. She's presented questions, right? I would love to have you all tell her how she can answer those questions and how we all can put our heads together, not with government being the solution. Like that, we got to stop. That's part of our culture in this county. Okay, now I would just say when General Lyon built Orangewood and the other group, they did it all through home aid, right? They provided a solution with Orangewood through the private sector. Scott Larson and other people.
If you call me back, because you own this phone
I
call.
texted you.
Yeah, but we're getting off topic now. Update you on things that we're working on.
Oh, I see. Okay. All right. Is that your hook to get me to call you back?
Update you on what we're working on, and you can call me back.
Let me bring it back to the meeting. You all can figure out your schedules, and we have witnesses now. So thank you, Maddie. And yes, Vice Chair.
First of all, I would like to say thank you for actually answering the RFP and taking the risk to be innovative and helping families. The very reason that HomeAid purchased and renovated the family care center is because families were showing up to the cold weather shelters. And something that resonated with me was that you said, we know that it's taking 4 to 6 months to get a family into shelter. So I want to make sure that we heard that, because if the family care center does not exist, I can't imagine what that number would be. So thank you for taking the risk. I'm in the fight with you.
I think
I also want to echo and thank you for your presentation. And I think my comment, maybe last question, is what has been said here, but I want us to think about in 4 or 5 months, we're going to have this inclement weather again. So is this going to be a model that we replicate, or is it something else? I think you sort of mentioned there's things in the works, but I wouldn't want us to get to that place and be in a crunch again, because it's going to happen. We know 4 or 5 months from now, this challenge is going to begin again.
Yes, Commissioner Wynn and then Morse.
Am I supposed to push up? That's how often I speak here on this committee. I also want to thank you because when I was here the first time actually about 15 years ago, we had similar issues. And I remember going to the shelters and there were children in the shelters. And immediately I got the board to start getting vouchers. Any children under 18 has to leave that shelter that night. And we moved our families in to these. And then the next day, the county comes in and assists them, trying to get them all the needs they need. And one of the things is that it's important because a lot of these children that goes to the shelter closes at 5 and kids don't go to school till 8. So the family, all they were doing was walking around the neighborhood waiting until the school opens. And we got wind of it, and like I said, I visited the shelter, and what you've done here, 15 years later, has been, a phenomenal thing and we need more, because there are more and more children that are out there that we don't want them to fall through the crack. So appreciate it.
Well, and Commissioner Spitz was looking for resources on how to incubate ideas. I would like to remind everybody here that Continuum of Care has a whole lived experience advisory committee. And they are quite glad to give opinions on any subject at all. And we've done a good job of having made changes to improve the COC's operations with the homeless. And plus, they have an excellent chairman.
Absolutely.
I just want to appreciate, and I think that's part of our lesson learned in the family's experience, where we thought, of course you'll want to stay at a motel. Of course you're sleeping in a, haphazard garage, come to a motel. And the families were like, do you know how much work that is for me? And so I think just living that feedback mechanism from our families is very loud and clear. So I think, extended time frames, sort of what can we do differently, knowing that the families were at the forefront of that feedback.
That's great.
I want to add one thing that I think answers some of the questions that have been asked. And we see it each year with our cold weather shelter. And with any effort here in our community, it takes the buy-in from many different groups. It takes the buy-in, it takes the support, it takes the funding. And that has always been challenging. And I think when it comes to the cold weather shelter, there is no greater example of that. Buy-in from our partners, funding is a challenge. You need all of them, because even when we have the funding, if we don't have the support of our partners in other jurisdictions, we hit significant roadblocks. And what's great about what was presented today, and what I really appreciate about the chairman, is his interest and willingness to put some of his discretionary money forward. And like what has been discussed, is just let's do it. And the difficult part in my position, I would say, and in much of the work that I do, is that even with that attitude, there isn't always an opportunity to do it that way. So these issues are really complex. I think this commission is a key stakeholder in this, and I appreciate Commissioner Spitzer talking about membership, because the function of this commission is not only to advise up to the Board of Supervisors, but it's also to come in and come to this table. And I appreciate so many of the commissioners around this table, and bring the resources that they are representative of, and then bring the discussion from this room back to their world. So, we are hoping that we continue to develop this commission in a way where we see that at greater frequency and greater strength.
Yeah, thank you, Doug. And, I don't want us to miss the point that Commissioner Bustamante was mentioning, because it will be upon us again when we ask that question, okay, what do we do for the upcoming season, which is going to be here before we know it. But I do want to say there's a park in Santa Ana on Standard and McFadden. It's not very big. It's maybe 1/4 of an acre, but it's precious, precious property because it's a pocket park that kids didn't have. When I became a new council member at the city, one of the stakeholders who lived in the area was also a teacher at Kennedy Elementary right across the street. And she was telling me the kids don't have a place to play and they're playing on the railroad tracks. And it broke my heart, right? So I found out who owned that corner parcel, and it was privately held. And we were going through the recession at the time, and it was dormant and vacant. People would just throw, old furniture. You probably know it, Supervisor, because it was your district at the time. And I approached him and said, "Look, you're probably not going to do much with this property for years because the market's just in terrible shape. Will you allow us to work with," and I think it was Mariners Church, Barry Cottle and his team, and others, and we all got together, and the mayor at that time in the city told me, "Don't do it. Bad idea. Kids are going to start getting used to seeing a park there, and one day it's going to go away and you're going to crush them." And I said, "Yeah, but even if it's for a year, a season, they're going to have a place to play that's not the railroad tracks." So we did it, and 5 years later, the owner of the lot said, "Look, I'm ready to sell. I have a buyer." And at that time, I was a more seasoned council member, and we figured out a land swap. We found him some property on Bristol, and he let the city have that property there, and it eventually went to the park system. And now it's a beautiful park named after the former Parks and Recs Commissioner, Gerardo Moet. And so, long story short, if you don't take these challenges on, despite, the risk, then you don't know what you have. Now you have a park there with a garden, with, a basketball court, and with things that kids never had. So I want us, and I'm hoping we can cultivate that discussion here where, yeah, things aren't easy and there's a lot of risk. But, Maddie's shown us that with a short, runway, she was able to stand something up and make it work. So I'm hoping that with that theme, we'll just continue moving forward. Thank you, Maddie, for that presentation. So I'll turn it over to the clerk to read the next item.
Item 5 is a presentation titled Homeless Death Review Committee Report on 2023 Homeless Deaths, presented by Kelly Estrada, Assistant Chief Deputy Coroner at Orange County Sheriff's Department. And we have no requests from the public to speak on this item.
Great. Thank you, Madam Clerk. So in January 2022, Sheriff Barnes announced his intent to commission the county's first homeless death review committee to analyze the number of deaths and causes of those deaths for persons experiencing homelessness in Orange County. At the June 2024 meeting of the Commission to Address Homelessness, we were presented the report on the 2022 homeless deaths by Assistant Deputy Chief Coroner Kelly Estrada. And at this time, I'd like to welcome her and Ray and turn it over to them for the presentation for 2023.
Right. Thank you, Mr. Chairman and Commissioners. I'm just going to kick it off and then hand it over to Kelly. But just wanted to give you all a little bit of background, and the chairman just did that very well, so I'll keep it even shorter. As you know, the sheriff formed this committee in 2022 at the beginning of that year, and this is our third report that we've done. Each year we look at the previous year. So in 2022, we looked at calendar year 2021 and issued a report at the end of that year. And in our third report, we're definitely seeing some trends in our homeless death. And our committee is made up of multiple stakeholders, whether it be folks from law enforcement, from county agencies, nonprofit groups, CalOptima, multiple folks that have participated and looked at the data, contributed their thoughts on the data, and really helped provide the data that we use in the report. And Kelly Estrada, who's part of our leadership team at the coroner's office, is going to go over that. And we continue as we look at the 2023 calendar year to see the homeless deaths increase. But there is some hope as we look forward to 2024, and Kelly's going to share those numbers. And I think those numbers really speak to the work that our county's done, whether it be through services, through housing, through street medicine, through prosecution of those that are trafficking drug dealers. And I think there's now with Prop 36 an opportunity to further build on that. So Kelly's going to share the data, and then we're happy to answer any questions.
Thank you, Ray, and thank you to the commission for having me back. Again, I'm Kelly Estrada. I'm the Assistant Chief Deputy Coroner with the Orange County Sheriff's Department Coroner Division, here to share some numbers with you. So again, this is a 2023 report on the persons experiencing homelessness deaths in Orange County. And as I mentioned at last meeting, the number for 2023, final count was 508 PEH deaths in Orange County. And Ray talked a little bit about trends. Beginning in 2019, we started to see a significant increase year over year, that being the most significant increase between 2019 and 20 at 55%. And then continuing on anywhere from 16 to 25% of an increase. So while 508 is an increase over the prior year at 496, I would like to point out it is only a 2.4% increase, so not increasing as significantly. And then Ray mentioned hope. I would just like to build on that and end this with a positive note that the number for 2024 has been finalized, and we're at 378. So from 2023 to 24, we have a 29% significant reduction in PEH deaths in Orange County, again, speaking to the initiatives countywide. To continue on and break this number down in a variety of ways, I'll start with the demographics. So we have on the left of your screen there, race and ethnicity. On the right, we have the gender of PEH deaths. And overall, we are seeing slight increases and decreases, but in essence, it is all still in line with the point in time count for race and ethnicity of the same year. So 54% white, 31% Hispanic, 6% Asian, 8% Black, and other unknown 1% of PEH decedents. And then moving over to gender, we have 82% being male and female being 18%. Specifically, as it applies to gender, we are seeing a slight overrepresentation there of the male population. So as compared to the point in time count of the same year, we had 73.5% of PEH identifying as male versus the 82% of PEH decedents being male. Breaking it down by age, the average age for PEH deaths in 2023 is 48. So an unfortunate statistic when you do consider the housed average age of death being 76. And then breaking this down for you by manner of death. And before I do that, I just always like to start with a description of what is a manner of death. What does that mean? So if you'll bear with me a second just to explain the difference between a manner and cause. So manner you can think of as the classification or the category of death. That's based on the coroner investigation and the circumstances surrounding the death. There are 5 potential options. First being natural. A natural death is solely and totally due to disease and or the aging process. An accidental death is due to an injury or poisoning with little to no evidence that it was intended to harm or cause death. A suicide is an injury or poisoning that is proven to be intentional or self-inflicted act. A homicide is a death resulting from a volitional act or a death at the hands of another. And then undetermined is essentially when there is not enough compelling evidence to categorize one way or another. So speaking just specifically on the manners of death, we do see the accidental deaths being the leading category for PEH deaths in Orange County. And this chart doesn't go back beyond 2019, but up until 2019, natural deaths were the predominant category that we saw for PEH decedents, and that we did see a change in 2019. That change has continued with accident being the top category year over year. However, I just want to point out there at the end that it is starting to decrease. So while 65% of deaths were accidental in 2022, we do see a decrease to that being 60% in 23. This gives you essentially a different look at that. So again, from 324 to 307, representing that 5% decrease. And then moving on to natural trends, 169 of the 508 due to natural causes. Homicide and suicide respectively with 7 and 22. So in general, we are seeing an increase in each category, but none as significant as in the accidental category. And then moving on to the causes of death. So again, differing from manner of cause is the specific condition or injury that led to the death. And we are seeing, unfortunately, a significant amount of those, vast majority being a result of overdose with 51% combined. So 43.3% of those are fentanyl related deaths. And then we do see 8.1% being non-fentanyl related. So that fentanyl statistic compared to last year stayed pretty static. I believe we were at 42% last year. However, there is a marked decrease in the non-fentanyl related. We were at 12.9% last year, and this year being 8.1%. And then we do have the second category there, remain the same with the pedestrian traffic fatalities. Moving on to the custody episode for PEH deaths in Orange County. Based on the booking records with the Orange County Sheriff's Department, we did find that 319 or 63% had at least one prior episode in custody, with 37% or 189 having never previously been in custody. Looking at the time of that custody episode, the vast majority had less than 7 days in custody, and you can see the breakdown there, with 84 spending 1 day or less in custody, and then 88 2 to 7 days. That did slightly change from last year. Last year's leading majority was in the 1 day or less category, so there is a slightly longer stay in custody, but still a very abbreviated time to have access to any services. And then lastly, the Cal Optum membership, so Cal Optima, excuse me. Of 508 PEH deaths, we found that 67 returned with eligibility information. So that accounted for 603 emergency room visits and 175 hospital admissions. And this is an increase from 2022 where that number was 59%. So we have Cal Optima eligibility increasing in the 2023 year to 67%. So with that, before I open up for any questions and feedback, I just want to close with the summary of the highlights of the findings from this year. So again, we have 508, which is just a 2.4% increase as compared to 2022. We do see the vast majority being predominantly male, whites, and the average death age is 48 years old. Again, for the third year, we do see accidental deaths being the leading manner of death, with 51% being related to overdose. And the second most common category being pedestrian traffic fatalities, where 87% of those cases, unfortunately, were found to be intoxicated at the time of their death. So with that, I'll open up for any questions or feedback.
Thank you, Kelly. Commissioner Bustamante.
Thank you. I'm just curious, for the rate that you have poisoning, overdose, non-fentanyl, do you have an idea of what those drugs were?
Predominantly methamphetamine, cocaine. I'm sorry, did that answer
Did
your
you
question?
mention alcohol?
Alcohol, I can give you the number. It wasn't reported, let's see, specific to the PEH deaths, but I do have that statistic overall. No, I apologize. I can follow up with the commission on that number as specific to PEH deaths. The information I have is for our overall caseload, but I can get the specific number back to the director.
Thank you.
Any other questions or
So,
Commissioner, please?
could you explain, what are we supposed to take away from the time in custody? What inference, you mentioned, I heard you mention something about getting services, but why are you keeping track of that data, and how do you all, your department, interpret that? That's a Ray question.
That's a me question. So one of the reasons we looked at the time in custody is one of the concerns that the sheriffs had is specific to the success of our programs. The fact that folks are in and out in such short increments, it doesn't really have the time for the program to have an impact because they are not in our custody that for that long period of time, that 30 days, that few weeks that you may need for that program to have an impact. The short, less than a day, less than a week, doesn't give us enough time.
Mr. Grangoff, is there a correlation? Give me the flip side. Is there a correlation between those who are in custody and statistics about how long their average lifespan? In other words, what are you studying, or how do you correlate the opposite, the inverse of that then?
I think that the programs that we've had where we've had someone go through because they're in our custody for that period of time, we actually have something to measure. With this population, we don't have anything to measure because it's not in this report, and we can send the numbers. It's not even that these folks are in programs. They're not even in a program because they're there for such a short period of time. So it's really difficult to say because they're in a program, they're less likely to die, but we know that they have more of a chance of being in a program that is going to give them some skills to be successful. So we can give you some numbers on the program participation rate as it relates to their time period. I just don't have that with me today.
You don't need to send that to me. I appreciate it. This is a very delicate and intense conversation for another day. And that is something that we talk about at OCC, JCC all the time. The sheriff has made this argument a long time, and it goes back to Prop 36. It sounds, let me just say it. The longer you keep people in custody who are addicted to drugs, the greater probability you have of them getting help because of the amazing programs that the county and the sheriff have committed to helping people in custody. But that is inversely, that is the inverse argument of individuals and the system that is trying to get people out of custody as soon as possible. So I just throw that out there because we're kind of in a very, and I deal with this every day, so that's kind of, this is kind of my lane, where we want to get people help and we want to get them the appropriate sentences and get them into programs in jail, especially if there is not an outpatient program for them, and an inpatient program would be more effective. So again, we're never going to resolve this today, but it is an issue that's kind of front and center on homelessness, because going back to Commissioner Hurst's point way earlier, the sooner we can intervene and get people help through some program, if we don't have their attention long enough in the jail, then nothing happens and they're more likely to end up dead. That's the way I think the data could be interpreted, at least preliminarily. If they don't get a program because of a short time and they just churn in and out of jail on short, like, cite and release kinds of things, trespassing, things like that, sleeping in public, alcohol intoxication in public, they don't get help. And they are more likely to end up deceased. It's really a difficult subject matter.
Yeah, that is definitely a topic for another day, because
Yeah,
we could
I
go on
know.
for probably 2 hours on that one. I also believe it kind of shows people come into the system with trauma. They're already, addicted. They're highly, compromised at that point, and their health is definitely, they're at very high risk. I also think it just shows there's just not sufficient treatment outside, to your point. The outpatient services that, maybe a Salvation Army or others show as a model, there just isn't enough. And I don't think, so the argument could be made, well, let's keep them in longer because that way we'll treat them and we convert our jail systems into treatment facilities, and that's not the function. So it is a complicated question, but with that, I'm going to turn it over to Doug to move us away from.
Yeah, and I think
Can I
that,
just ask one quick question
Yes,
on that?
please,
Do
Commissioner.
we track when they fell into homeless, how long that they have been homeless? Like, do we have any way to track back if they've been homeless for 7 years or 1 year or 6 years?
We have in the report data on their most recent custody experience. So we know that some have, their most recent custody experience was less than a year ago, or in some instances, it's several years since their most recent custody experience. But your question of how long they were in homelessness, I don't believe we would have that number.
I think it's an important part to add in the equation if we could, so maybe for a future conversation.
Yeah.
Thanks.
so that all ties into the few comments I want to make. I really appreciate this report. I really appreciate the presentation. We're working with the coroner's office to incorporate some HMIS data. It takes a little bit of time, but what I wanted to preview, and I think it speaks to the custody piece, is our office having access to HMIS is able to, and works very closely with the coroner's office to look name by name on this. And what we're also seeing is at the time of death in HMIS, which represents a large or tracks a large portion of the beds in Orange County, not all of them, less than 5% of them were in shelter. And then less than a third of them have a history of being in shelter. So yet again, it talks to being in a place where you can get services and engagement and help. Obviously, the jail is one place that, yeah, to the DA's point, the county and the sheriff's department have made really amazing work at ensuring that that's an opportunity for growth there. But yet it speaks about the ability to catch folks and engage them and provide them opportunity. So I, naturally from my seat, look at the value of shelter and housing, not only for the value of having a roof over your head, but often what that speaks to, that acceptance of services and then that access to services. So those are always my biggest takeaways from this report is how few of them are in shelter. Just, we don't have causation data, but it's so large, you know, the numbers are so jarring. I think it's hard to argue that there's not some type of relationship there.
Thank you, Doug. Thank you, Kelly, and thank you, Ray, for the presentation. So, Madam Clerk, I think we have one more presentation left. If you'll please read that out.
Yes, item 6 is the state legislative update presented by Peter DeMarco, Director of Legislative Affairs from the County Executive Office, and Nicole Wertelman, Legislative Advocate from Precision Advocacy. And we have no requests from the public to speak on this item.
Thank you. So, Peter, you're going to turn this over to Nicole really quickly. And by the way, Nicole was our guide yesterday and Monday in Sacramento. So thank you, Nicole.
So I can't show the slides from my
man,
trip.
you've got to just kick it over.
Good afternoon, Commissioners. I'm Peter DeMarco. I'm the Director of Legislative Affairs. Earlier today in this commission meeting, you heard from staff about the status of HAP Round 6 money and how that's being implemented here. The May revise budget from the governor proposed to eliminate any future HAP money. Last week, when the legislature put its proposal together, they've restored, not the ideal amount, but some of the money back into the legislature's version is better than nothing. We were able to get information that Salima shared together very, very quickly to our delegation members to be able to show how that money has been effectively used in Orange County. And that happens very quickly, not just with our staff on the ground, but with the county's lobbyists in Sacramento. Nicole Wertelman is with Precision Advocacy. Precision has represented the county of Orange and it's in Sacramento for the last 10 years. And Nicole's here to give a quick update on what's coming here, we think, as it relates to the budget. Nicole?
Thank you so much for having me. As everyone said, Nicole Wertelman with Precision Advocacy. I've been helping to represent the county for about 10 years. Let's see here. Okie dokie. Don't let the agenda scare you. We are going to go through this zippity quick. I want to talk first about the budget. As Peter said, the governor introduced his May revision to his January spending plan on May 14th. The legislature then took his proposal and worked out an agreement amongst themselves. So more specifically, the Senate and Assembly worked out their budget agreement and went ahead and sent it to the governor on Friday the 13th. Make of that what you will. And they will now be negotiating with the governor to send him additional, what we call budget bill juniors, to amend the plan that they sent to him. We also anticipate that based on what the federal government does, there's probably going to be action into the fall and early next year as well. In terms of homelessness funding, as Peter said, there is some HAP funding in there. It is $500 million anticipated in 26-27. Assemblymember Quirk Silva was really instrumental in assisting to secure the funding. And she really did encourage us to talk to the delegation and advocate for it strongly, which we did. The other pots of funding here come from the Department of Social Services. You've got some funding for homelessness for people on CalWorks, for families involved with the child welfare system, for adult protective services, and for people with disabilities. On housing funding, the governor did not propose any additional funding for the low-income housing tax credit. Under current statute, it receives $120 million each year. The budget sent to the governor by the legislature has an additional $500 million in it. Additionally, they put in funding for the multifamily housing program, which is the largest pot of funding from the state for building and preserving affordable rental units. And then the Dream for All program is assistance for low-income home buyers on their down payment. Uh-oh. Okie dokie. There also has been some agreement on some budget-related legislation. Details are still to be worked out, but you have AB 609 and SB 607, and generally speaking, they both relate to CEQA streamlining for the construction of affordable housing. And then the legislature and governor are both interested in putting forth affordable housing bond acts. The governor would like to include infrastructure in the package. And there are two vehicles right now. AB 736 appears to be the most viable as it's been moving forward and is now in the Senate. However, SB 417 is almost identical, and they can choose to use whichever vehicle that they want to. Mostly, I think it's important to note, and Commissioner Spitzer will tell you this is a snapshot in time. So these numbers within the next 2 weeks, they could all be a bit different. We are certainly advocating for and hoping to continue to secure homelessness and housing funding in this budget year and continuing. But with the deficit currently, it's going to be a tenuous situation. And then mostly, if you all have any questions, I'm here for it.
Thank you, Nicole. Thank you, Peter. I'll go ahead and see if there's any questions or comments. If not, to be continued, right? More to follow. Thank you both. We only have one item left, which is our action item. I'll go ahead and, Madam Clerk, read that item out.
Yes, item 7 is to approve the commission to address homelessness minutes from the April 16th, 2025 regular meeting, and we have no requests from the public to speak on this item.
Any motion? There's a motion and a second. All those in favor? Motion is by the Vice Chair, and the second is by Commissioner Parks.
Thank you.
Questions or comments? Seeing none. All those in favor? All those opposed, motion carries. Thank you, everybody. This concludes a meeting of our commission, and our next meeting is on August 20th at 1 p.m. Thank you. I'll see you then. Have a great day.